It's been 11 years I've been with Esperanza. When I came to Philadelphia in 2008, I was really lost, really depressed. I'm actually a recovering drug addict, so at the time I was on drugs. When I found Esperanza, things just became so much easier for me. Without Esperanza, I would still be in drugs, on the street, hopeless. I would be lost.
When Esperanza started, none of us had any idea that we would even survive, let alone prosper for 30 years. If I had known all that would be involved in getting involved with Esperanza, I don't know if I would have had the courage to start. Thank God I didn't know, and we blindly went forward, trusting one step at a time. Esperanza came out of a Bible study that we've been doing for about 1.5 years in our church about the kingdom of God. And we came to understand that God is reigning. And if He's reigning, we better figure out what He wants and start doing it. And that would include in healthcare. The community was a combination of good, hardworking people who were doing their best to raise their families under very difficult circumstances. On the other hand, disease statistics that were far worse than other parts of the city, educational challenges. Only 1/4 of boys finished high school in that neighborhood.
Esperanza, when it first started, was in a second floor walk-up. In other words, you had to climb steps to get to our waiting area. There was no elevator. So for some people, even walking up our steps was an exercise stress test.
Back on the old site, we had a number of leaks where the medical unit above us literally would rain down on us. We had a number of times the generator ran out and the doctors would continue seeing their patients with a headlamp on. It was interesting.
We attended everyone, doesn't matter who you were. If you came to the clinic, you were treated with respect, with love, and you were giving a message that you were important because God is the one who was ruling us.
We were dedicated, but we weren't very experienced. We weren't terribly knowledgeable. We had sort of a basic competence, but nothing special. We were just people who loved God and were trying to do the best we could.
They didn't have money to pay the employees. Esperanza was gonna close, or they didn't even know if they could open the door the next day.
At the beginning, we didn't know much about the business component. Billing was a challenge, but we didn't know how to do that. Or how do you go and ask other social service, what is available for your client? Little by little, we learned, we figured out what was right for them.
I started coming here almost 20 years ago, I would say. It's literally become a part of my life. I felt hopeless before I got here, and now I feel so much hope. I've battled with hepatitis C for years, and they helped me out tremendously with my neuropathy, my blood pressure.
Hello, God bless you. How are you?
The people are wonderful. They have become like family to me. The doctors, they pray for you before you leave. That blows me away every time.
Tú sabes que ya es
These people have literally kept me alive by the grace of God.
A person of faith, if they believe what they say they believe, their faith will involve every part of their lives, and that will include their daily work, their daily interactions with other people. So it has to affect the way they take care of people. I consider myself a committed Christian, but I have to say every time I came to Esperanza and worked with the people who were here, I felt put to shame by their faith and by their dedication and commitment. They're wonderful people.
Take a deep breath.
The people here, they're amazing. They're supportive, they're loving, they treat you like you're a human being. Back in November, I was shot in an attempted robbery in front of my house. I was in the hospital for a long time, and Esperanza used to come every every week to come see me. A doctor would come see me. I had Esperanza there to support me through all my trials and tribulations. They've been the backbone of me moving forward.
I think I'm getting a little bit of a glimpse as to what's bringing her in today. Basically, the way I think about it is, compelled by the love of Christ, we serve. And would you say she's otherwise well? We care for our patients, we care for our community, to do what we can to see that child thrive, to see them grow, to see them flourish, to be the child that God made them to be. And I think working here gives the opportunity to put hands and feet to that, in some ways practice that discipleship. That includes caring for their physical health, their emotional health, for the family's health too. Obesity, diabetes, substance use and addiction, moms having difficulty with resources, all those things are interconnected.
Everybody's treated equal, fair, and the most important thing is with respect. There's times that, you know, they'll sit here and if you don't understand something, they'll sit here and explain it all the way till you fully understand and make sure you're satisfied before you leave.
We're gonna get you your 3 vaccines, all right, Zachy?
It's been a beautiful thing. I wouldn't ask for a better doctor.
Showing us that she's prone to react. Without Esperanza, I think ultimately people's health would get cared for, but it would be in a very, very different way. There's love here, which is not guaranteed. You don't get everywhere.
I'm from this neighborhood, and I understand that being able to communicate efficiently is paramount in ensuring that a patient gets good care. There is something to be said when you speak the language of a patient that says, I want to know you, I want to have a relationship with you, I want to step into your space and get to know you a bit more. It's one of the things about Esperanza that I think makes it unique.
Luchando con drogas en la calle. No, yo solo. Okay. At Esperanza, all of our clinical staff are required to be functional in both Spanish and, of course, English as well.
Tráigalo por favor la próxima vez para que puedo.
I had to learn Spanish too. I knew a few Spanish words, that's about it, before I knew I was coming to Esperanza. But via some language training, I was able to gradually learn enough Spanish to be able to start at Esperanza. Being able to speak to someone in their language, being able to communicate in their language is everything when it comes to being able to provide health care. But that's the personal touch that's impossible, I think, unless you can directly communicate with somebody in their language of the heart.
Si el peso todavía es un problema, podemos seguir buscando la leche.
At Esperanza, we're trying to talk to the patient, get to the root of what it is that's causing them a problem or why they're coming in here, and maybe offer them something in a more holistic way.
Esperanza has looked to serve the needs of the people in more than just medical care, emphasizing good nutrition, exercise, education, health promotion, all kinds of things that they just didn't have the ability to even think about when Esperanza started.
We have a little bit of everything. We have the gym, we have the cafe, we have yoga.
Nutrition services, cooking classes.
The behavioral health department, you're able to see a therapist.
Case managers who go out to homes, HIV care, social services, insurance assistance.
The patient never leaves without any resources or anything to start working on that problem that they're facing.
I've been here for 15 years. When I first started here at Esperanza, we could all fit into one little room. We sat around one table, and now we have 3 sites. We're almost 200 people, so the number of people has changed dramatically.
But we still operate the same way Dr. Klaus operated at the beginning, which is, can we bring God's kingdom come here on earth as it is in heaven? Can we care about patients in the way that Jesus cared about them?
It's made a wonderful difference in my life and my health. I tell everybody about Esperanza, you know, I trust them with my life.
As I look at what Esperanza is now, 30 years after we started, that it survived it all, and second of all, what it has become, my feelings are feelings of complete awe What has happened is certainly not something I can take responsibility for. No individual can. It's been something that God has brought together through many people, through many resources, just in a marvelous sort of way. I think everybody who knew us back when we started is amazed at what Esperanza is now. It is a work of God.